Hello and welcome to Women's Health. My name is Kathy Romacher. I'm the president of Women's Foundation of Lincoln and Lancaster County, and we host these programs to help women and men learn about health concerns that they might have. Today we are talking to Simone Martin, who is going to be talking to us about urinary tract infections. And I'm going to ask Simone to introduce herself. Hi, Simone.
Hi, I'm Simone Martin. I'm a nurse practitioner that works at Nebraska Urology.
Okay, and how long have you been in practice?
Since 2013, and I've been here the whole time.
Okay, fantastic. Well, we know that urinary tract infections is something that a lot of women struggle with, and I think there's a lot of information that we can give people, hopefully, in this program that can be really important for them. So let's start out talking. How frequent or how often do you hear about urinary tract infections? What are some of the statistics?
Well, on a daily basis, we treat people, all of us, for urinary tract infections. But as women, in a lifetime, 96% of women are going to get at least one urinary tract infection in their lifetime, where men are going to get, probably 77% of men will get a urinary tract infection in their lifetime. So it is very prevalent.
Yeah, it is. And I think a lot of people have issues and symptoms, but they don't necessarily always get the help they need. And so we're going to try to talk today about some of the myths and misinformation, but also some really important information that can help people in the future. So let's talk about causes of UTI. We're going to say UTIs instead of urinary tract infections every time. So we'll say UTIs. So what are some of the common reasons for them?
Well, it all depends on age. So when it comes to the very young, because it can happen even in toddler age, they can get urinary tract infections. A lot of times those are more due to their anatomy that may be on the inside of the body, maybe some reflux of urine that is going back up into the ureters that could be causing those, and that needs to be tested with special tests to find those out. Constipation is also a very big reason for urinary tract infections that can happen in that 0 to age 14 age group, but then also in our 40 to death age group as well. So constipation is a huge factor in urinary tract infections. But for women in general, the fact that we just have a very short urethra compared to men is the biggest reason why we're more susceptible to having urinary tract infections more than men.
Okay. And so when we suspect that we have a urinary tract infection, what's the best procedure?
Well, if you think you have a urinary tract infection, the very first thing you should do is really just push water. Because if you have a true urinary tract infection, then you're probably not going to just flush it out or make it go away. So if your symptoms go away after you've had ample water, less caffeine, less spicy or maybe foods that affect the individual, then it may not be a urinary tract infection, and water is a good preventer of urinary tract infections. But if those symptoms persist, which could be burning, could be frequency at night and during the day, could be pain in the abdomen, fever, chills, those are all symptoms. But sometimes people will have none of those symptoms, and their only symptom may be incontinence. So if all of a sudden you have incontinence that comes out of nowhere, then that could be your symptom of a urinary tract infection. So they're not all cut and dry. Not everybody has the same symptoms for a urinary tract infection.
Yeah, so it's very different. Mm-hmm. And is it different between men and women?
Men will also get that frequency, burning, but they can have incontinence also, that urgency, that sensation of needing to go all the time but barely going. People will think they're in retention. It's just that they're going so frequently that they're not even giving their bladder enough time to actually fill. So we here at Urology do a bladder scan post-urination to make certain that you're not in retention. But many times, if it's just a true urinary tract infection, you're just going so frequently that you have small amounts of urine each time.
Okay. Okay. So is the best thing then to try over-the-counter things? Should you go directly to a medical professional? What's the best procedure if you really do have those symptoms and you think you have a urinary tract infection?
Most of those urinary products over the counter, they're not going to treat a specific bacteria like E. coli, Pseudomonas, Proteus, Klebsiella, which are the top urinary tract infections if they're cultured out. But they may treat the symptoms. So if it's only treating the symptoms and stop the urgency or stop the burning, then maybe it's not a urinary tract infection. Maybe it's overactive bladder that you have, and we need to treat you for something different. So it's not that we only see people for urinary tract infections, but those symptoms don't always mean an infection, but it doesn't mean they don't always need to have some sort of treatment plan. Starting with your primary care physician is completely fine, but we are happy to see anybody here if there's further questions and if the symptoms persist even despite having different treatments. So then we can kind of delve into it further and see what's been tried and what needs to happen next.
Okay. So you mentioned treatment. So what are some of the most common treatments and then maybe some of the more specialized treatments that have to be done?
Well, it depends on the age group. So if we go to the very young, then a lot of times, sometimes we'll do just like a plain film x-ray and make certain that we don't see constipation. And if we do, then it may be starting a stool softener and getting the bowels so that they're working better, and that can be the cause or the treatment for the urinary tract infection. We also look at how much water a person's drinking and make certain that it's not more pop, coffee, tea, or sports drinks, artificial sweeteners. All those things can cause bladder irritation and make you feel like you have a urinary tract infection, even though it's really just that you're drinking all those things and really no water. Water is very important for all of us. So that is part of that. But then when we have our women that have maybe had a hysterectomy in like their early 30s or have gone through menopause, then atrophy, that can be a big symptom. So atrophy, dryness, changes in the tissues around the urethra, around the vaginal canal, those can make you feel like you have a urinary tract infection. Just from wiping too much can give you microscopic little tears. Then you have burning. When you have burning, you have irritation. That irritation seems to be worse at night than it is during the day a lot of times, when your brain is not focused on everything else.
Right.
And then it turns on and you are noticing this irritation, so then you have frequency. So like a generic estrase cream is something good to use. Just plain vitamin A and D ointment from the baby counter, Vaseline, all on just the outside. Those things can all help those symptoms and make things healthier and make it so that you don't have the symptoms. And they're also very preventative. The number one prevention of urinary tract infection in postmenopausal women, whether it be from menopause or from hysterectomy, is estradiol cream. It's used 3 times a week, and it is only working at these tissues. It is not considered an estrogen replacement.
Okay.
It is not something that's going to give us breast cancer, blood clots, or all the other problems, but it's also not going to save our bones or do anything that people get estrogen from. It's only for those tissues.
Okay. That's really interesting. And also, what about other kinds of treatments that are preventative? Like, what kinds of things can you take or do to prevent the...
So if somebody is truly getting cultured out E. coli infections and it's constantly E. coli, that is symptomatic, which is very important to say, because an E. coli infection that is not symptomatic does not need to be treated. Of all urinary tract infections, 22% of them have multi-drug resistances that we're finding in the United States from overuse of antibiotics.
Oh, from antibiotics, okay.
So if there's no symptoms, if you're getting up 0 to 2 times a night, if you can go 3 hours between urination, if you're not having fever, chills, or burning, if you're not having incontinence, you do not need to be treated for your urinary tract infection. You may just have it and it's not going to cause you problems. But if you did have symptoms, then we like to do the culture. If you were having significant symptoms, then we may start you on an antibiotic right away. If the symptoms are mild, we may wait that 2 to 3 days for that culture to come back, so we know that we treat you correctly, especially people with multiple allergies, multiple symptomatic symptoms from antibiotics like nausea, vomiting, diarrhea, which could just make things worse. Some people, the older we get, can get confusion from some antibiotics. Some people that are on multiple blood pressure medications, diabetic medications, those antibiotics can make changes in those medications. So instead of just throwing an antibiotic to somebody with very minimal symptoms, we'll wait for that culture and then pick the one that's the safest for that person and the best for that organism that grew out.
That makes a lot of sense. But people who do have recurring problems, then how do they deal with it in the long term if we're not going to try to put them on a lot of antibiotics?
We always try to do the first parts of managing water intake, constipation. You can start a vitamin C or a cranberry tablet once or twice a day. There's multiple milligrams out there. You can just pick one and take one twice a day. And there's not a special formula of how much cranberry you need. But that water really is important, 2 to 3 liters a day. Most people who do not drink hardly any water at all, I try to talk them into 48 ounces just to get used to drinking water. People who think they're a good water drinker, I try to get them to drink at least 64 ounces a day, just to make certain that they're getting that water in, because sometimes we don't really realize until we just sit down and measure how much water we're drinking to know if we're drinking enough.
But we can't count water if it's things like pop or...
No, that's actually negative. So none of those things count as far as your water. And artificial sweeteners can cause a lot of problems with the bladder. So
is that right?
Mm-hmm.
Oh.
A lot of frequency, urgency, and then people think that that's the urinary tract infection, but it's really just those artificial sweeteners that are in things.
That I can see where that could be a problem, because a lot of times people who do think they're drinking a lot of water, they're putting a little bit of artificial sweetener or some kind of, raspberry or blueberry or something in their water.
Yeah, and sometimes I find in January and February, it's kind of like the kickoff, everybody wants to lose weight, and they start doing some different things that are fluid-based that are supposed to give them energy and help them lose weight, and that's the cause for the frequency and the urgency. Not a urinary tract infection.
So just plain water. Mm-hmm. Just suck
plain
it up
water. Yep.
and have plain water.
Yes.
There you go.
You can add lemon to it. You could add a fresh cucumber. You could add strawberries. You could add some blueberries, or you can use a diffuser, so you can flavor it with fresh things that's not going to then cause you the artificial sweeteners and give you a little bit of flavor so that it actually tastes palatable. Some people just don't like water. And it doesn't have to be cold water, and it doesn't have to be warm water. It can just be water.
Yeah.
So you don't have to freeze and have ice water.
Yeah.
You can have room temp water.
So what about a product called D-mannose?
D-mannose is a vitamin, and it's very bladder specific. It's very good for helping to prevent E. coli infections. It's great for preventing infections in people that have a chronic indwelling catheter, that have to have a catheter at all times or have to use a catheter to empty their bladders. Then that's a great antibiotic to be on to reduce the risk of infections. And it's 2,000 milligrams or 2 grams a day. You can do it in a divided dose of 1,000 and 1,000, or you can take 2,000 all at once.
How do you know if you need that?
If you've had cultured E. coli infections, 3 in 1 year, then I would start it.
Yeah. But usually a physician would tell you that, or a doctor, somebody would tell you.
Yes.
Yeah. Okay, that makes sense. Let's talk now about the elderly. And there's been some information out recently about the elderly and urinary tract infections, and maybe they don't have exactly the same symptoms and the severity of those and how dangerous they might be. So let's do a little switch to the elderly and talk about that for just a little bit.
Well, I would like to back that off a little bit, just because I feel like the word elderly is much older, when honestly uncomplicated urinary tract infections are typically people who are under 65, and it's more common to have a complicated urinary tract infection over the age of 65.
Wow.
But also all men are considered a complicated urinary tract infection compared to women. So it's not always about the elderly, so it can start at 65 and up is when you can start getting those complicated urinary tract infections.
And what causes a complicated one?
Well, with a complicated one, it's typically giving you more of a systemic infection and can be more of the infection going up into the kidneys, not just at the bladder, or more of a real cystitis that takes a longer treatment. And some of those reasons can be because of a stone. So that can happen at any age. A kidney stone can brew up in the kidney and start making a urinary tract infection. Well, when we treat that with an antibiotic, we're treating, but that bacteria sticks to the stone, so then it's going to be recurrent. So one of the things we may need to do with people with multiple urinary tract infections is get a CT scan to make certain that there's no stones. But also, as women age, we have more of a tendency for prolapse of the bladder, prolapse of the rectum, prolapse of the top of the vaginal canal or the uterus. And then because of that prolapse, we don't empty our bladder efficiently. So then when you're not emptying your bladder efficiently, you're leaving a volume in the bladder, and then that's giving us these complicated infections and can cause retention that can go up into the ureters, into the kidneys, and cause a more severe infection, which is why men can have complicated urinary tract infections. The prostate can get in the way, maybe cause them to start forming bladder stones because of not emptying efficiently, have incomplete bladder emptying that may be going up into their kidneys on both sides or one side. And those are things that need to. So until you treat the problem, you're not going to get rid of the infection. It's going to keep coming back.
Right. Well, I think that sometimes when we hear about an elderly woman, and I'm talking probably 70s, 80s, whatever, they end up in the hospital and it's a really big deal. And sometimes when they're interviewed, they say, I didn't even know that I had anything. So yes. That's why I was asking that question. How can they not know they have anything?
I'm not dismissing that that happens. It definitely does happen, but there can be lots of things that are going on. So I never want us to just like pinpoint just to the urinary tract infection. Somebody who is of that age that we know that they have healthy tissues, that we've done a straight cath where we've gotten the specimen straight from the bladder, that is going to be more, we're going to be able to tell more if that infection is truly from the bladder and not a contaminated specimen. When you're 70 and above and you do not have estradiol as part of your treatment plan, then multiple urinalysis, just getting a plain urinalysis, can look really bad without it being a urinary tract infection. We'll have people come in, give us a urine sample, and then we can see that it has epithelial cells, which are not from the bladder. So then we go and get a specimen straight from the bladder, and we come back, and all of a sudden that 3+ bacteria is a 0. The red blood cells are a 0. The white blood cells are a 0. The inflammation is a 0 because the inflammation's on the outside of the body, not in the bladder, where somebody may have been getting antibiotics for all of these voided samples. But when you get one straight from the bladder, and then we're assessing that, and we see the redness, the irritation, the atrophy, the lack of the labial folds, everything's adhesed, like that people don't realize that's happening. There's more going on than a urinary tract infection.
Right, and so important to get good medical treatment then, not to try to self-treat, but to really go and see a professional.
And a full assessment.
Yeah, and get a full assessment so that you know what the real problem is, because maybe there's things that are being attributed to UTIs that are really not.
Right, like urinary incontinence. And urinary incontinence can be going backwards with that incomplete bladder emptying. If the bladder is at capacity and the person doesn't realize it because they have none of those symptoms of fullness or pain of a full bladder, but they're urinating frequently, you may be only urinating just a little bit off each time, but leaving 400 or more in there all the time. And that's causing the incontinence and the urinary tract infections. So we need to get that bladder to empty. So that's really an important assessment to make certain that that's not part of the reason.
So let's talk about bladder problems for a little bit, because it sounds like the bladder and UTIs, it's all a big issue, right? And so
Yes.
bladder is another thing I think that a lot of people have maybe some misconceptions about.
Yes.
So let's talk a little bit about what part does the bladder play in some of these things?
Well, the bladder is can either be overactive or it can be underactive. Somebody with diabetes, especially if they've had diabetes that's been uncontrolled, then that bladder can sometimes just decide not to want to work. And they can have a bladder that doesn't want to compress. A bladder sits closed after urination, and then from the bottom starts to fill up, and then when it gets so full, we get the signal that we need to go to the bathroom, and then it compresses down. So it's not just an open cavity that's always there that drains and fills. It's a big muscle that is either shrunk down the way it's supposed to be or full. But if that muscle is not working, then you can't squeeze and bend and push and make that happen, so you're still going to have that full bladder. So that may be treated with having to place a catheter that may be temporary, just like every so often, to drain your bladder so that we don't have that fullness, which is then going to cause problems up in the kidneys. If that bladder's full, then it can come up to the kidneys. And that can get rid of incontinence, frequency, nighttime frequency, urinary tract infections, help everything if we just got your bladder to empty. But if that bladder is pushing forward into that vaginal canal and then maybe coming down out, then that urethra is kinked and U-shaped, so then you have this full bladder and you're urinating just little bits because you can't get it in there. So we may need to put a pessary and put it back up so then you can empty more efficiently. Maybe you need to have surgery where we put some mesh in there so it holds the front and the back of the vaginal canal up so that you can empty efficiently, which then decreases the risk for infection. Not to mention, when the bladder's out, that's actually the inside of the vaginal canal that's out there. All of our vaginas have bacteria, and they're supposed to. If we didn't have bacteria, we'd have yeast. So then we have all of that bacteria that we're then urinating over. So there's no good samples if you're urinating over that tissue, because it's going to be bacteria in the cup that some people are getting treated for when it's not even an infection. It's normal bacteria that's there.
Mm-hmm. So bladder issues then are something that women really need to pay attention to and get some good help for.
Yes.
Is there any kind of preventative thing you can do for bladder issues like that?
Estradiol cream, starting that, postmenopausal, perimenopausal, can help those tissues to stay healthy, to try to prevent bladder prolapse or vaginal prolapse to begin with. Doing exercises and having good pelvic health. So Kegel exercises and just trying to do kind of an uplifting instead of just kind of letting everything fall down. But people who have like a lot of standing, they can have problems. So you don't have to have had children to have prolapse. So that's a myth. You can have had no children and still have prolapse.
Okay.
So it's not just the women that have had multiple children that are going to have prolapse.
And you mentioned the mesh. What is the mesh thing that people talk about with the bladder?
A sacrocolpexy is what I'm talking about for prolapse. For urinary incontinence, it would be a sling.
Oh, a
but
sling.
So there's two different types. But as far as urinary incontinence, there's multiple types of urinary incontinence. So you may see like a Botox commercial and then come in and be like, I need Botox, I have this. Or you see a medication and think that that's what you need. First, we have to figure out the type. One, are you emptying your bladder? Is it only withstanding? Do you have frequency at night or during the day? Do you have both frequency at night or during the day? Do you have infections that could be causing your frequency of urination and your incontinence? So we got to rule out some of those other things and then kind of pinpoint what is it that you need for your urinary incontinence, because there's multiple treatments, but not one thing fits all of them.
What would you say to someone who feels uncomfortable about talking about this? Some people maybe have these issues, have these problems, but it's very personal, and a lot of people may not really want to talk about it. So what would you say to them?
I would say please come in and talk to us, because there's many things out there that people have, including urinary incontinence, feel like they may have an odor, fecal incontinence, constipation, things that change their life. Nighttime frequency or daytime frequency that keep them from their kids' activities or from even leaving the home because they're fearful of leaking or having a problem, whether it be bowel or bladder. There's things that can be done. I cannot believe how many people come in and think that just because they're of a certain age that this is what's supposed to be expected in their life, and it's not. Many of these things can be treated, can be prevented, can be fixed, and have changes in their whole entire life. If you get sleep and you're not up multiple times a night, it gives you a whole different outlook on how you see life because you actually got good sleep. But there's no need to be ashamed of these things. It is not your fault. You're not causing the problem. If anything, sometimes people are too clean, which I would like to throw that in there. Stay away from antibacterial soaps except for your hands. They don't belong where the sun doesn't shine because it causes yeast infections or just makes things too dry and causes more problems. So we don't need to be super clean. Multiple people think that they come in and that we're going to think that they're just not clean and that's why they're not having problems. That is not the problem. There is something else that needs to be figured out. We can get to the bottom of that problem and make things better.
Well, this has been very, very helpful. Really appreciate it. I just want to mention again that these programs are provided by the Women's Foundation of Lincoln and Lancaster County. My name is Kathy Ermacher. I'm the president of the Women's Foundation, and we're glad to know any topics that you might be interested in, so please let us know. Please join us on other programs of women's health.